Right, hello again and welcome. We are going to review together the muscles of the head and neck that we learned together in the lab at the CCAC. We have several layers of muscles. Some of them are fairly superficial muscles. We're going to go initially over the superficial muscles before we start covering the deep muscles and the muscles of your pharynx and the muscles that control the tongue and the hyoid bone and underneath your neck and that are giving support also to the neck and move the neck. Let's start with the superficial muscles that we see here on this model. We will see here three very thin small muscles that are mainly fibrous tissue really in human. These are superior, anterior, and posterior auricularis muscle. They're supposed to be wiggling your ear. That is a rudimentary function in human. We have it more in animals, rabbits, cats, that they have those muscles much better developed than us. We have another superficial muscle here, and we call that Occipital Frontalis. You will see that the Occipital Frontalis has a frontal belly on the anterior side and an occipital belly, and in between them we have aponeurosis, a very thick connective tissue that holds the two muscles together on top of your skull. If I would move the model interiorly a little bit so I can show you the muscles of the face. We agreed in the lab that we will have two circular muscles, and we called them orbicularis, and if you ever forget, then O is for orbicularis and O is also for circular. So we have orbicularis oculi, we also have orbicularis oris. The orbicularis oculi will be shutting down the eye. Orbicularis oris would be closing the lips together like when you're whistling. Other muscles we see here would be muscles that are still moving your lip. This one over here would be inserting itself to the upper lip, and we'll call that levator labii superioris. Levator labii superioris. This muscle here is elevating or pulling the angle of your mouth. We call that muscle superior anguli oris. Anguli is for angle. So superior anguli oris and superior labii superioris. And since we have superior anguli oris, then we have also inferior anguli oris, which is also referred to sometimes as triangularis, because it really looks like a triangle. We have a horizontal muscle in between. That horizontal muscle will make you grin, or you show your teeth, your molars, if it pulls the angle of the mouth, as you can imagine. That would be your risorius muscle. We have two muscles here that are coming down from the zygomatic process. We'll call one of them zygomaticus major, and the other one will be your zygomaticus minor. If I move the model interior towards you more to show you more muscles that control the mouth, we will have a muscle here that is pulling the lower lip down, and that would be your depressor labii inferioris. Depressor labii inferioris. And we have a tiny muscle here that would be your mentalis muscle. That leaves us with a couple of more muscles to discuss. One of them is your platysma muscle, and you can see it here. It goes all over your neck to the upper portion of your shoulder and the upper portion of the anterior part of your chest. That's your platysma muscle. One more muscle that is buried deep inside here that will be your Buccinator muscle. It's very important, has an important function in chewing, because it does keep the food from accumulating between the cheek and the teeth, so it pushes the food back to in between the teeth. That's your Buccinator muscle. The nerve supply for all those muscles we discussed is simple, is your facial nerve, which is emerging from underneath the parotid gland here. As you may remember, we mentioned when we were talking about the skull bone, or the skull bones, that the stylomastoid foramen is where your facial nerve is emerging, and you can see some branches here of the facial nerve that supplies all the muscles, almost all the muscles of the face. Leaves us again with a couple of small muscles to mention briefly. That would be your Nasalis muscle, which helps in opening your nostrils. Again, it's also supplied by our famous facial nerve. If we go a little deeper, we will see a muscle here that would be our sternocleidomastoid. It's partially covered now by the platysma muscle, but we will see a better angle of it when I show you the other side. But that, however, is your sternocleidomastoid. Alright? So we're gonna flip this to the other side that allows us to see more of the deeper structures. We agreed before that this big muscle here is very important in mastication, which allows the closure of your mandible. That is your temporalis muscle. That's your temporalis muscle. It inserts itself into the coronoid process of the mandible, and of course helps in what we call elevation, which is another word for closure of your jaw, of your oral cavity. The other muscle that does just that, it has an origin here, but we cut it to show you the deeper structure, and inserts itself into the ramus at the angle here of your mandible. We call that your Masseter muscle. Both these muscles are supplied by the mandibular branch of the trigeminal nerve. So I'm going to take this guy out to show you what lies underneath. We will recognize that we have two muscles. I hope this will be clear enough. Perhaps I can zoom it in to make it to make the viewing a little better. Here we go. Maybe that didn't help much. Well, maybe it did. So we will have here two other important muscles that are also associated with your mastication. You have your medial trigoid muscle, and you have your lateral trigoid muscle. The medial trigoid muscle would be, both of them will be originating from the trigoid plates of the sphenoid bone, if you remember that from the skull. The medial trigoid would insert itself, however, on the anterior surface of the ramus, near the angle of the mandible, as you saw when we were removing the bone, and the other one would be also inserting itself into the mandible, very close to where the condyloid process is. Those two muscles, in addition to closing your jaw, or what we refer to as elevation of the jaw, they also perform side-to-side movement. So the side-to-side movement of the jaw is only brought about by the trigoid, the medial and the lateral trigoid muscles. I'm going to zoom out now to go back to our general view. So we can go back to the rest of the muscles. All right. So this muscle here is what we saw on the other side. That was our sternocleidomastoid. Sternocleidomastoid. It has an origin from the sternum, from the clavicle, and then it inserts itself into the mastoid process. That was our sternocleidomastoid. Underneath it, we will see a few important muscles. We have here a muscle that is coming from the mastoid process, and it's tapering in, and then it will continue. If I will flip this into another muscle that's underneath your chin, that is your digastric muscle. This is the posterior belly of the digastric. The anterior belly of the digastric will be here under the chin, and I will show that to you when I turn the model to show you the bottom or underneath the chin. It leaves us with a couple of other muscles. One of them is originating from the process we named styloid process, and inserts itself into the hyoid bone, and therefore we call it stylohyoid. We have another stylo muscle, but you can't see it much from here, but it's underneath there. That would be yours also stylo, but inserts itself into the tongue, and therefore we called it styloglossus muscle. So we have stylohyoid and styloglossus muscle. Please do remember, from this model, from this angle here, the muscle you're looking at here is your digastric muscle. That's your posterior belly of your digastric muscle. Right here we will have the scalene muscle, the anterior, middle, and posterior scalene muscle, 24, 25, and 26. These are posterior, middle, and anterior scalene muscles, which are very important in elevating the ribs during heavy breathing, but also if you stabilize your ribs, and they can also help in flexing the neck. All right? Let's try to see the muscles here. I'm going to lower the camera a little bit to enable us to see the muscles of the lower portion of the neck. All right, that will work. All right, we will see a muscle here that's originating again. This is the sternum. It's originating from the sternum, and it would go all the way to the top to the hyoid bone, which is, you cannot see from this angle, but the hyoid bone would be over here. So that would be your sternocleidohyoid muscle. Not all the muscles that originate from here go all the way to the hyoid bone. Some of them will terminate short, and we have one of them here. It's originating also from the sternum, but would go only to the thyroid cartilage. As you can see here, that would be your sternothyroid. Then we have a smaller muscle that goes from the thyroid into the hyoid bone. That would be your thyrohyoid muscle. The action of these muscles, of course, is simple. You can just imagine which one is the weaker and which one is the mobile one. The sternum, of course, is the less mobile partner here, so it would depress the hyoid bone. The sternothyroid will depress the thyroid cartilage, whereas the thyrohyoid, it depends. It can elevate the thyroid or depress the hyoid, either or. We have an important muscle here with a unique course that initiates itself. This is the trapezius I just removed, which you will learn about when we cover the appendicular skeleton and the anatomy of the upper arm. We have a muscle that originates here at the shoulder, from the superior angle of your scapula, and it turns medially, and then it hooks itself around a very strong connective tissue fibers here before it turns upwards, because it's coming from the shoulder to the hyoid, we'll call that omo, which is short, which is for shoulder, omohyoid. That's your omohyoid muscle. All right, and we will get now into the. I hope I can show this. No, I will have to move the camera physically. So let's try this. And I'm a little clumsy with technology. I hope you don't mind on the fighting with the camera while I'm trying to take pictures. I'm not trying to scare you, and it's not Halloween yet, but I'm trying to show you the chin from below, because I can't lift that model. Okay, here we go. So the chin from below, you will see here, this is your mandible, of course, and then we will see a muscle here attaching to the chin, and then inserting itself into a very thin tendon that will continue as another muscle backwards. That guy here would be our anterior belly of the digastric muscle. Anterior belly of the digastric muscle, and we learned before that the posterior belly of the digastric has an origin from the mastoid process. Right underneath it, you will see a flat sort of a diaphragm muscle that is behind or above the digastric muscle. That will be your mylohyoid muscle. Mylohyoid muscle. All right. So this is the muscle I tried to show you. Didn't really mean to scare you, but since it's Halloween is coming, so maybe it's not a bad idea after all. Let's get into the very final portion of our head and neck muscle anatomy, which is dealing with the muscles that move the hyoid and the tongue. And for that, we have to open our model to show you these structures as you see here. All right. Okay, this will work. Muscles that are originating from the inside of the chin, we will start referring to as genio. So we have a muscle that's coming from this part of the chin here to the hyoid bone. We call that geniohyoid muscle, geniohyoid muscle. We have one that comes from also the same part, going from the symphysis of your mandible, the area where the two bones meet together, into the tongue, that is your tongue. That would be genioglossus. Genioglossus. So we have geniohyoid and genioglossus muscle. We have, in addition, the flat muscle I showed you earlier, which was your mylohyoid bone. That is this part here, as you see once we cut it sagittally. These are the structures I wanted to share with you. The muscles of the head and neck, and we discussed some of the nerve supply and the action of them. That doesn't mean that this is all, but since this is review, we're gonna stop here, and I will see you in the next videos for the other muscles of the upper and lower limb. Before we terminate this, there are two more muscles I want you to pay attention to on the back of the neck. One of them, the lateral one, would be this one inserting itself into the superior nuchal line, but also to the mastoid process. That would be your splenius capitis, and medial to it will have another muscle that will be your semispinalis capitis. Semispinalis capitis. So semispinalis capitis and splenius capitis. Alright, that covers all our muscles in our model. I wish you well, and we'll see you in the next videos.